Okay, today we're going to be going over giving PED-MEGs through either an NG tube, but we're going to be demonstrating it on the PEG itself today. So just like with any of our skills, we're always going to be checking our doctor's orders, and then we're going to identify anything in the chart that we need to know, and then we're also going to be checking our policy and procedure. So I've got Anna Taylor, date of birth 4/24/1991, drug allergies, no known drug allergies. And so I'm going to be checking her orders today. We're going to be giving her metoprolol 100 milligrams PO daily per PEG tube, Pepsid 20 milligrams oral suspension daily per PEG tube. Flush the PEG tube with 15 mils of water before and after each medication. I know in our policy and procedure it says that the first flush that we do or irrigation should be 30 mils. But one of the things we're going to be assessing on our patient is are they on any kind of fluid restrictions? And so in this case, the doctor specifically ordered the 15 mils before and after. And of course, then we're going to put the medication, once we crush it, in 30 mils, and then we irrigate with 15 in between. So we'll need to count all of that up at the end so that we have an accurate I and O on that, okay? So once we've checked the doctor's orders, another thing that I'm going to be looking for in my doctor's orders, or just in general in my chart, is any significance in vital signs, any labs I need to be paying attention to. I'm going to be looking at if they've had any kind of side effects or problems with any of the meds that they've taken so far. With the medications, I'm going to make sure that they can be crushed, especially if it's in a pill form. Now, if it's in a liquid form, it's not a problem, but if it's not in the pill form that's not crushable, then we would need to contact pharmacy to see if there was something we could change that to. So checking to make sure that it is, and metoprolol, I think I have one that is, that it does, you can crush it. Now, so we talked about ice, fluid restriction. The other thing that we would be looking at when we go in there, of course, we're going to be doing an abdominal assessment, just to make sure if there's any distension, firmness, the abdominal girth, any tenderness, checking for what kind of bowel sounds that they have, the inspection, auscultation, and then palpation with that. So once we have checked our doctor's orders, checked the chart, checked the policy and procedure, we need to also look in the chart to see what kind of learning our patient needs, what kind of education, how do they learn. They're probably going to go home with that PEG. There's a possibility, so we need to make sure we have someone that we can teach how to do that whenever they get home. And so then we're also going to be, so we're doing our teaching on there. We're going to look at the supplies that we need. Always with any of our procedures, we're always using good lighting in there. And so I'm going to make sure that I have all of my supplies. I have a blue pad. I've got, of course, a stethoscope. I've got my, this is a 60 mil syringe. I've got my irrigation kit here. I'm also going to have my sterile water for the in-between. I've got my pill cutter there. Of course, we're always going to have gloves as well with that. And enteral syringe, medications. I'll be pulling those medications, and of course our sterile water. Okay, so once we have all of that, then we're going to go ahead and start with doing our 5 rights and 3 checks. And so as a student, the nurse will have pulled your meds for you. And so the first thing we're going to do is we're going to check to make sure that the MAR matches the doctor's orders. Okay, so I'm going to start with my doctor's orders. Anna Taylor, date of birth 4/24/1991, no known drug allergies. The orders are for metoprolol 100 milligrams PO daily per PEG tube, Pepsid 20 milligrams oral suspension daily per PEG tube, and then flush the PEG tube with 15 mils of water before and after each medication. Okay. So now that I know, I'm going to start comparing one medication to the MAR at a time. So Anna Taylor, date of birth 4/24/1991, no known drug allergies. I've got metoprolol 100 milligrams PO daily per peg tube. So I'm going to flip over to my MAR. And I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. And I have metoprolol 100 milligrams daily per peg tube. And this one is scheduled at 9 o'clock. So that is correct. So I'm going to go back to my doctor's orders. Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Pepcid 20 milligrams oral suspension daily per peg tube. I'm going to go to my MAR. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. And I have Pepcid 20 milligrams oral suspension daily per peg tube. And this is going to be my 9 o'clock dose. So I'll go back to my orders. That's the last medication that I'm going to be giving per peg. But I just want to read it again. Flush peg tube with 15 mils of water before and after each medication. Like I said, the policy says 30 mils to irrigate with, and then 15 at the end and 15 between meds. But the doctor specifically says 15 before and after. Okay. So once I've done that, I'm going to go to my MAR and I'm going to verify that I have, so I'm putting my first initial, my last name, and my credentials, that I have verified this MAR. And then I'm going to go to the bottom under, it has name. I'm going to put my first initial, my last name. I'm going to put my title. And then my initials, okay? So that way anybody that looks in that area will know who gave that medication. Okay, so once that we have done we've done our verification of doctor's orders, we've done that, now we're going to go ahead and do our first 2 checks before we go into the patient's room. So I have my MAR pulled up. I have got my medications here. Okay, so I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have metoprolol 100 milligrams daily per peg tube. This is going to be my 9 o'clock dose. In my hand, I have metoprolol 100 milligrams, expiration 2/20/25. It's intact, and so that is my first check. I'm going to go back up to Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Pepcid 20 milligrams oral suspension daily per peg tube. This is the 9 o'clock dose, and I have Pepcid 20 milligrams. It's per 15 mils. Expiration's 1/1/2030, and the expiration, and so it's with intact. Okay, and so since I'm giving 20 milligrams, I need to give 15 mils that medication. So that was my first check. Now I'm going to make sure I have a pill crusher, and I've got my sterile water for when I get in there. I've got my also my pH indicator here because we want to make sure that we're testing if we're doing the NG, we'll be testing that here in just a little bit. All right, so I've done my first check. Now I'm going to go ahead and do my second check. So I've got Anna Taylor, date of birth 4/24/1991, no known drug allergies. Metoprolol 100 milligrams daily per peg tube at 9 o'clock. And I have metoprolol 100 milligrams, expiration 2/20/25. And again, it's intact, and so I'm going to put it in, because I'll be mixing it with 30, once I crush it, 30 mils of water, okay? And I've got a couple of extras here for waters, and that's my second check on that. I have Anna Taylor, date of birth 4/24/1991, no known drug allergies. I have Pepcid 20 milligrams oral suspension daily per peg tube at 9 o'clock. And so in my hand, I have Pepcid. It's 20 milligrams per 15 mils. Expiration 1/1/2030, and so it's intact, and since I'm giving 20 milligrams and this says per 15 mils, I'll be giving 15 mils. And that's my 9 o'clock dose, so that's my second check with that. So once I've done that, I'm going to go ahead and close out my computer at the nurse's station. And I'm going to go ahead and get ready to go to the patient's room. So I've got all of my supplies with me. So I'm going to go to the patient's room. Knock, knock, knock. I'm going to come in, do a medical hand wash. I'm going to pull my computer up. Good morning. My name is Jan Bucks-Kimber, and I'm a registered nurse, and you would identify yourself as a student. So let me get all my things pulled up here. And so can you, I told you who I was, and can you tell me what your name and date of birth is? Okay. Anna Taylor, okay, date of birth 4/24/1991. Now, are you allergic to any kind of medications? No, not any medications, and that's what I have here. And so I'm going to go ahead and scan your armband. Okay, and we've got your armband scanned, okay? And so, so once we've done that, Miss Taylor, we're going to be giving you your medications. I've got some 9 o'clock medications. We're going to be giving them through your PEG tube. And I've made sure I provide for privacy. And so we are going to be, now, ask your name, date of birth, any allergies. I asked for, you said no drug allergies, but any other kind of allergies to non-drug stuff? No? Okay. And are you in any pain right now on a scale of 0 to 10, 0 being no pain, 10 being the most pain? What would you say? No pain? Okay, great. If you were, we would go through the Caldera, but you're not in any kind of pain. So now, if you had, at this point, I'm going to go ahead and wash my hands again, and I'm going to put some gloves on. If at this point we had the enteral feeding going through our PEG tube, we would go ahead and disconnect it here, and the tubing coming from the enteral, we would make sure we put a tip on it so it didn't get contaminated, and then we would make sure we had that closed right there. Okay. All right. So, and I'm going to take those off right now. Glove to glove, skin to skin. And I'll do my hand wash again. So we had to. Okay, so now we're going to go ahead and do our third check with our patient with our medications. So I have Anna Taylor, date of birth 4/24/1991. My scanner. We have no known drug allergies. Metoprolol 100 milligrams daily per PEG tube at 9 o'clock. And so in my hand, I have metoprolol. It's 100 milligrams. Expiration 2/20/25, and it's intact, so it's good. So I'm going to go ahead and scan my medication. Okay, so that's my third check. And I have Anna Taylor, date of birth 4/24/1991. No known drug allergies. My next medication is Pepcid 20 milligrams oral suspension daily per PEG tube. This is going to be the 9 o'clock dose. Okay, and I've got Pepcid 20 milligrams per 15 mils. Expiration 1/1/2030, and it's intact. And so I'm giving 20, so I'm going to do 15 mils. Okay, so I've got my medication scanned. And so I'm going to go ahead and kind of get my stuff ready to do that. Okay, so We're going to be giving you two medications. We're going to be giving you metoprolol, we're going to be giving you Pepcid. And so with these two medications, I need to do an assessment with those, and I will be teaching you about those medications. So with the Pepcid, it's to help with acid in your stomach, and when you're in the hospital and you've got things going on, you've got extra stress, extra acid, sometimes it helps with this because you don't have a diagnosis for GERD. It helps to decrease your chances of getting a gastric ulcer, a duodenal ulcer, and so we'll be giving you that. And then metoprolol is a beta blocker, and so it helps reduce, it's for your blood pressure. It helps with lowering your heart rate and also your blood pressure. So we're going to take those before we actually do our anything else. And so I'm going to put some alcohol preps in here. Alright, I'm going to go ahead and get your blood pressure done. Do you know what your normal blood pressure runs? 120, something like that? Okay. So we're going to go ahead and so we want to make sure we're in the right parameters before we give this metoprolol. So let me go ahead and clean my stethoscope. And then we're also going to be listening to your apical pulse, and I'll do that after I get through with your blood pressure. Okay, it was 118/78, so I'll remember that, 118/78. That's a good blood pressure, so that's within the normal range, so we can go ahead and give your metoprolol based on that. We also have to do your apical pulse. So again, we've provided for privacy. And we're going to go to the 5th intercostal midclavicular, and so that's going to be just right up underneath your breast right here. But for me to listen, I'm going to put it right over here. So we're going to listen for this for a full minute. Okay, I got 80, so we're good there. And I'm going to lay you back so we can, now we don't want to leave you laying flat for too long because you did have that intro feeding going, or even after we have our, and just exposing what we need. I need to leave you at a 30-degree angle. So we're going to listen to all 4 quadrants. I'm just going to, normally we'll want to bend stethoscope to skin. So I'm going to kind of listen around so I can hear your, okay. okay? So before I started, I had already assessed, inspected, and so I did the auscultation, and now we're going to palpate. Now, you told me earlier you weren't in any pain, okay? So if you are in any pain while I'm palpating, just let me know, okay? And so I'm just going to lightly palpate. Now, I could have put gloves on, but I didn't think I was going to come into contact with any body fluids, so I didn't have any gloves on with that. So I'm going to go ahead and cover you up real quick. And we're going to go ahead and let me do a medical hand wash real quick. And let me just check my chart here real quick. Okay, and so 118 over 78 and 84 to do that. Okay, so I don't want to leave you at that, so I'm going to go ahead and bring you back up to a 30 to 45 degree angle, okay? And so you need to maintain, if you're doing the enteral feeding, you need to make sure you stay at 35 degree angles. If you don't, and we're giving meds, then we've got to leave you up for at least an hour for that, okay? All right, so I'm going to go ahead and get some gloves on because I need to go ahead and get my medications ready. Okay, so we talked about the medications. With the metoprolol, since it is a beta blocker, and we talked about it will decrease your heart rate, and all your parameters were good. You need to make sure that if you get dizzy, sometimes it can make you lightheaded, that you let us know before you get up. With the Pepsid, again, it's to help with reducing so I've got my sterile water, reducing any kind of gastric acid, but if you start having any kind of stomach aches or any kind of, if you feel like you've kind of aspirated something, that's why we want to keep your head up. Or, you know, if you're seeing that you've got some like black tarry stools, then just let us know on that. So beta blockers, just get up carefully, make sure you're not dizzy before you get up, call somebody to get some help. Okay, so I'm going to get my pill crusher, and this was washed from the one time before, and this is our metoprolol. It is a crushable medication. I want to make sure that I keep my medication with the one that I'm going to be using. So we're going to get that mixed up in there good. And so this was mixed with 30 mils of the sterile water. And then I'm going to get my 15 because we're going to flush in between. So finding my 15, there it is. Okay. And then I've got my Pepsid, which it is the 15 as well. So, you see a 15. You always want to get down eye level where the meniscus is, okay? And so that's with that medication, and then I need one more 15 for the end. And with my water, I had checked it prior to, also making sure that it wasn't expired and that it was intact as well. So Okay, so again, we want to make sure that you're staying at this level for at least an hour. And if we have tube feedings, you're going to stay at 30 degrees at all times, okay? So, all right, I'm going to get my syringe out. Okay, so we've got our medications. We've got, now we're going to go ahead and we've got a couple of things that we need to do right now. So I need to, now if we were going to be doing an NGT, we need to check for placement before we put those meds down. And so placement with an NG2 would be looking at the marker that is at the nose, making sure it's there, and then we would also remove some fluid and we would double check our pH. And on this one, we're going to make sure that it was less than 5.5, okay? So that would be if we were doing the NG2. On the PEG tube, we need to make sure that it's not clogged to begin with. And then we're also going to be checking the marker at the skin level for this as well, okay, to make sure that the marker, if it's come out or you can't see it, then we would need to stop, okay? That would be unexpected. So the expected, we're going to look at that marker right there. Okay, so with this, if you can clamp it, you clamp it, but these don't clamp. With this, I'm going to go ahead and I'm going to pull back, because we de-seed that tube feeding a little bit ago. So I'm going to pull back and I'm going to just see how much residual that we have in there, okay? And so I'm going to make sure I measure how much residual is in there, so I can document that. And then so it looks like it's very minimum residual in there. I'm going to say 5 mils, and then I'm going to go ahead and put that back in there, okay? I'm going to clamp it. I'm going to take that off, clamp that back up real quick, and then I need to take this part of my syringe out. And I need to make sure, okay, so we're giving the metoprolol. It's in 30 mils, and then we're going to flush with 15. Actually, we're going to flush first with 15, and then we're going to, so we've got our flush 15 to begin with, and then we're going to give the med, which is in 30, flush again in between with 15. We're going to give the med, which it's at 15, and then we're going to flush again at the end. Okay, I think we're ready to do this, so I'm going to go ahead and clamp it. I'm going to go ahead and put my syringe in there. I'm going to get my first 15 again. Policy says 13, but the doctor specifically said 15. So I'm going to pour that in there. I'm going to go ahead and let that by gravity. I'm going to go ahead and clamp it. This is my metoprolol. I've mixed it up. I'm pouring the whole 30 in there. I'm going to unclamp it. Let it go by gravity. I'm going to clamp it. I need to irrigate or do 15 of the sterile water, so we're going to do the 15 to flush in between. And this whole time I was making sure it wasn't clogged, but obviously it's not because it's the gravity. Okay, once that's in, then I'm going to get my Pepsid, pour that in, unclamp, let it go by gravity, clamp, get my last 15 of sterile water, pour it in there, and then let it go by gravity. Okay, so once that's gone by gravity, we're going to go ahead and clamp that. Take that off, go ahead and put our cap back on it. So we flushed with the 15, we had 30, 15, 15, and 15, so we had 30, 30, so 90 is what we had in our, for our total, for our I's and O's, because this patient is currently on fluid restriction based on the doctor only wanting 15 given before, okay? We'll pour all of that in there. We'll get that clean so the next person can use it. We're going to be using that here. So I'm going to go ahead and now we're going to leave your head up for an hour, okay? And then if we need to, we'll check the orders to see if we need to hook up that your enteral feeding again if you had it going to begin with. I changed my gloves and I didn't clean up, so let me clean you up real quick. Should have done that before, but okay, how are you feeling? Okay, you doing okay? I'm going to go ahead and clean this up. I'm just checking your bandage just to make sure that it's clean and dry. Because really didn't get anything on it, but it could have. And we're going to put that in there. Okay, glove to glove, skin to skin. And then I'm going to come over here and I'm going to document. Let me do my medical hand wash. Again, we're going to leave you at a 30 to 45 degree angle this whole time. And so let me come over here to my MAR, and on my metoprolol, I'm going to put my JB, and I'm also going to put my apical pulse was 80, which was within the parameters. Normally it says if it's less than 60 to hold, and my blood pressure was 118/80, and a lot of times they say if the systolic is less than 100 to hold it, but your parameters were all good. And so I documented that one, and then I'm going to my PEPCID, put my JB on there so that I gave that. I'm going to go ahead and save that, showing that those meds were given, and they were given by the PEG meds there. So before I leave, I want to make sure I put the bed in the lowest position. Oh, you know what? I didn't get it up there, but you're high enough that I didn't really need it. But I would have raised it if I needed to, but we were right here. You were actually with this bed the way it is. But make sure the bed's in the lowest position, side rails up ×2, and the wheels are locked, and we've got our call light within reach. Okay. And I've got everything cleaned up. I'll take this with me. This stuff is going to stay in the room with you. You have your water if you need it, if we're not MPO, which I didn't see that you were MPO with that. Okay, so I'm going to go ahead and if we found anything that was unusual or abnormal, we would let the doctor know, specifically if your vital signs, if it was clogged and we weren't able to get it unclogged. There's a policy to get that unclogged, but we didn't have any problems with that, so we would notify and document if we had any problems, that we notified the healthcare people. Just let us know. I'm going to come back in 20 to 30 minutes just to make sure that you're not having any side effects to your medications. But if you need anything or you feel like you're having some problems, just put your call out on. But let us know if you're having any kind of nausea, vomiting, if you feel like your stomach is getting distended, any diarrhea, if you're having problems with constipation, because we can give you stuff with that. And then if you feel like you are starting to have problems breathing, that maybe that's why we're keeping your head up, so you don't have any reflux and it gets down into your lungs. So we don't want to have any aspiration with that. And then we'll be documenting when we come back in 30 minutes, 20 minutes, if you were having any kind of medication problems, and that what position that we left you in. which is the 30 degrees. We're going to be looking at the eyes and nose, we're documenting eyes and nose, and any teaching that we did. So we taught you on your medications and how you, if you verbalized any questions about that, and if you understood that, or if you feel like you've had any problems with that. Okay, so once I have done all of that and I've done my medications, I'm going to go ahead and close out my chart here. And so the bed's in low position, side goes up ×2, wheels locked, your call light's within reach. So I'm going to go ahead and get your table closed, and I'm going to go ahead and take my stuff, and as I walk out of the room, I'm going to go ahead and do my medical hand wash. And again, if you need anything, just put your call light on. All right, we'll see you in 20-30 minutes.